Stop. Yes. Okay, great. Thanks, everybody. Hi. Welcome to the Winter 2023 School-Based Health Center Coordinators Meeting. I'm Kate O'Donnell, she, her pronouns. I'm the team lead with the School-Based Health Center program. Hope you all enjoyed our great British baking show entry music as we waited for us to get started. So for folks who are new, welcome. If this is your first meeting, these coordinators meetings are our quarterly opportunity for SBHC staff coordinators to get together and hear updates from the SBHC state program and partners about things relevant to their school-based health centers. So we have a full agenda as usual today. So if you could, in the chat, share your name, your role, and the SBHCs you work with so we can get to know each other. And then I will get us started. So here is our agenda today. As you can see, we have a lot of stuff built in. We're going to start with state program office updates. Then we'll have a quick break because we have just so much to share with you today. Then after the break, we're going to hear from the oral health program at OHA. Then we'll hear about early periodic screening, diagnostic, and treatment for EPSCT. And then finally, we hear from the Oregon School-Based Health Alliance before we get to closing. And we do have about 10 minutes left over for Q&A or discussion if folks want to chat towards the end. Thanks to everyone who's putting their name and information in the chat. It's great to see some familiar faces and new folks chat too. So welcome, everyone. So just some more housekeeping before we get started. If you could update your Zoom name so people know who you are. We're asking again because we just had such a packed agenda for people to keep their questions and comments in the chat box, and we'll try and pause periodically to make sure that any questions our comments are addressed. Also, we know that an hour and a half meeting, 2-hour meetings are very, very long for folks, and you have very busy schedules, lots of stuff going on. And so just a reminder to take care of yourself as you need to during the meeting, get up, stretch, jump off, jump back on. We'll have a recording up on our website in at least a week or so, so people can come on and check that out if you've missed something during the meeting. And with that, I'm going to get us right into state program office updates. So just a reminder, this is our team. Oh, wow, Mike, I noticed you just put on a new photo with a dog photo. I feel like we should all update our photos with pictures of our pets in this bio section. But here's our team. I think many of you know us if you've been around for a long time. So this is half of our team. And here on this slide is the second half of our team, mostly our data and certification folks. Okay, important topic that I'm sure everyone wants to hear about. We're going to start by talking about state program office funding. So I will start, this is a little bit of old news at this point, but just wanted to just go into it during the meeting so folks had a chance to ask questions and just hear it from us. So I think many of you will remember a survey went out back in the fall, I think in November, asking about if there was extra funding available from our office for this biennium, folks would be able to use it. We heard from most of you, so 34 out of the 37 SBHC systems, which is the SBHC medical sponsors, responded. And we asked both if you expected to spend down the funding that you have and if you could use any extra funding if it was available. Not surprising, everybody said that they would be spending down their base funding, which is the $60,000 in base operating funding that you all get from our office. And then most people said that they expected to spend down mental health expansion grant money. I think the only folks that weren't able to do that was because of just inability to fill positions. And then similarly, almost everyone said that they would be able to spend down an additional $5,000 to $10,000 if they were able to, if that was available from our office. And then we asked, what would people use it for? And most frequent, the top one was clinical supplies. People also wanted to go to conferences, do outreach and events, and then support some staff time. So, what our takeaway from that was there's a real clear need from sites for additional funding. I mean, I think as you all know, um, the $60,000 in base funding that we provide is not enough to fully sustain a school-based health center, so every little bit helps. However, unfortunately, after going through our budget reconciliation process, we don't have any additional funding to provide to folks for this biennium. Um, we are using this information to help us plan for the upcoming biennium, so the next fiscal cycle that will start in July 1 of this year. And hopefully we can, if we anticipate any surplus, we're really going to try and front load it for you all this time around, so that you can use the money to support some of the things you mentioned in the survey responses. I know one important thing that's come up is folks need to update their iPads for the satisfaction survey. So we want to make sure that you have money available to do that too. The only thing about front loading funding like that is that it may limit some flexibility towards the end of the biennium. So let's say if we have a new site come in, but we'll try and keep all that in mind as we look to build our budget for next biennium. Hey, I'm going to pass it to Rosalind.
Hello, everyone. Good afternoon. Rosalind Liu, she, her pronouns. I'm the manager for adolescent school health. And it's great to be in this space with all the school-based health center coordinators. Okay, budget and legislative session. So it's pretty early in the process. But I will give a little bit of an update. So the school-based health center budget, as you all know, has the base and the mental health expansion grant funding. And at this point, we are stable. So there have been no requests for cut scenarios. But as I said, it's pretty early. And as the legislature moves forward and as the revenue forecasts come out, it could change and we may be asked to do some cut scenarios. And people who have been around for a while, depending on how big those cut scenarios are, we sometimes reach out to the field to ask about impact. But at this point, we're stable, and so that's all good. And so people can kind of predict, at least at this point, for stable funding moving forward. There is a bill in session currently, and the Oregon School-Based Health Alliance is here today, and I'm thinking that they'll probably talk a little bit more about it. Anna's nodding her head yes. And these are some of the components of the bill, and anyone who's been in legislative session knows that there are deadlines for bills to be introduced, and then bills can change language. There's work that happens in the work sessions with legislatures and advocates. But this was what was introduced so far. So there is a proposed increase to the base funding that would put the base up to a minimum of $66,000 per year. There is money in there for planning grants to support the school nursing and school-based health center models. There is some money referenced for school-based mental health grants. There are grants for trauma-informed approaches and grants for wraparound service delivery hubs. The first three are specific to OHA, and the trauma-informed and the wraparound service components are through the Oregon Department of Education. Next slide. Okay, a little bit about the process for legislature. So legislature started, again, there is a bill, but our budget, our public health budget, our OHA budget is also determined through this process. So there's the governor's recommended budget, and that was released on January 30th. There's a link in there. And the governor's recommended budget is kind of the step one of the budget process. And so in the public health division, there was a lot of positive things that were moved forward. There's components of modernization. There's some reproductive health work. There's a lot of regional health equity investments in regional health equity coalitions, but it's a lot of information, but people can go in and take a look. Thanks, Micah, for dropping the link. I think that's probably what you did. And then what'll happen is there will be budget hearings probably around March where agencies will talk about their proposed budget. So OHAs will go in and specifically Public Health Division will talk about what budgets are part of that. And then around April, May, the co-chairs will present a budget. And then with all of that, there will be a decided budget and it will be the legislatively adopted budget, which is what we move forward with for 23-25 biennium. And that will start on July 1. And so sine die, so when legislative session ends is June 25th. And I always say it's not over until it's over. So we may see movement on things now. We may see things die pretty quickly. We may see movement in other areas. And people who have been around session or track bills is that new language gets puts in that may impact us or impact school-based health centers. And our team and our government relations team tries to track all of those. And so if there are health systems related bills or school health related bills, the team is trying to track those and we think about impact to school-based health centers. And at this point, again, it's really early in the process, but there are opportunities where the field would be really important to give comments or feedback. And again, the Alliance is tracking these bills similarly, and there is definitely space for hearing impact of bills to school-based health centers and the school-based health center communities or school health in general. So we try to get the information out. If there are bills that directly impact school-based health centers, the Alliance tries to do that. If you all hear about something that you think is good for us to know about, please feel free to reach out to us or the Alliance because we can try to see if there's something else that we should be tracking also. I think that's it for me. I'm happy to take any questions in the chat.
Yeah, please in the chat if you have questions about legislative budget, fiscal stuff. Feel free to do that before we move on to the next section. Okay, this is also not your last chance, so I'll move on, but please feel free to write in the chat if you have questions. Okay, I'm going to move us on to certification, and Melanie, go ahead.
Hi, everybody. Melanie Potter. I use she, her pronouns. I'm the School Health Program Specialist. Nice to see you all again. As Kate mentioned in our last coordinators meeting, we're going through a standards for certification review. And one thing we are doing to support that we are hosting a series of youth listening sessions. So for this, we're going to be engaging Oregon youth ages 15 to 21 who currently attend a school that has a school-based health center. We'll be conducting these listening sessions in March and going through some questions to talk to them about their healthcare experiences and experiences with their school-based health centers and any challenges that they may have had, and also chat with them about any suggestions they have for school-based health center improvements. As you can see, we have a picture of the flyer that we sent out to you all, and I just want to let you all know we already have over 700 responses. So nice work, y'all, on getting the word out. There was lots of interest, and the application process for signing up will close on the 10th, and then we'll start reaching out to folks and setting those up. Oh, and we'll be using the information that we get from young people to help inform the review process. Thanks.
Thanks, Melanie. And just a reminder for folks, we did a bigger presentation on what the certification review process will look like, but we are here in the youth feedback sessions just for this school year. Look in the spring for a survey that will go out to kind of help us get information from you all in advance of our certification review process kicking off. Okay, again, please feel free to enter questions in the chat. We'll get to them. Okay, I'm going to switch gears and talk about the SBHC eligibility policy. So just a refresher, if you were not here at the last meeting, we talked about the use of what we call eligibility policies. The two main ones are outlined on the slide. They're what are sometimes called opt-out or opt-in policies. An opt-out policy is when parents are able to opt a kiddo out of receiving services at a school-based health center, regardless of their ability to self-consent under Oregon minor consent law. And opt-in policies are when parents are required to provide consent for their kiddo to provide access services at the SBHC, regardless of their ability to self-consent. So these are things that we've heard that centers do over the course of many years, but we haven't really systematically asked to see how widespread these practices are. So you may remember this fall, we sent out a survey to get a sense of who had these policies in place at their SBHCs. Really just wanted to get a lay of the land and understand, as it says on the slide specifically, if they have an eligibility policy, if it's opt out or opt in, what exemptions people have, and then if those policies apply to everyone providing services at the SBHC or just some of the partner agencies. So we heard from everybody. Thank you so much for taking the time to reply to the survey. Super helpful to see what the landscape is. And so we wanted to share back some of the responses with you. So as you can see, 76 of the SBHCs that responded, so 92% do not have an eligibility policy. So neither an opt-out or opt-in, they just kind of straightforward follow Oregon minor consent. And I should say, we heard from everyone who's currently certified, as well as 2 centers that are opening this month, actually. So they responded about their policy. Of the 7 SBHCs that do have eligibility policies in place, the majority are opt-out policies. So again, it's parents coming in and saying, we don't want our kiddo to receive services, we're opting them out of the SBHC. And then 2 have opt-in policies, which is you need parental consent to access a particular service or the SBHC in general. One of them was just for specific services at the SBHC, so not a blanket one. And another was due to the somewhat unique nature of the school setting. The center is located in a boarding school, and so they have a opt-in policy. I also wanted to take some time just to share some quotes that we received in the survey. We had a box for open comments. And so we got some really helpful comments, I thought, from folks about how these policies are and are not working for them in their school-based health centers. So some are saying, like, we've had a policy like this for a long time, and we actually have moved away from it recently after a lot of conversation with our school district and partners. Others say, like, it has helped them to have conversations with parents and guardians, but ultimately maybe they follow minor consent law if it comes down to it. And then did get a pretty clear ask from at least one respondent to change our policy on this as a program and restrict the use of eligibility policies. And so that goes into, and we can resend this if folks haven't seen it, but we did release a policy on our stance on the use of eligibility policy, our policy on the use of policies. And so basically it says that we will continue to allow folks to use a policy, an opt-in or opt-out eligibility policy for right now. We don't recommend them because they're obviously present barriers to access for young people and can kind of compound on if students are having trouble, and need help to get into the center, it can make it even more difficult. So we don't recommend them by any means, and it's definitely something that we're looking at as we revise our standards for certification. So yeah, we just wanted to report back out on that for you all. And so I don't think any more information is going to come on that in the immediate term, but just so that you're aware, we do have that policy available if you'd like us to resend it. somewhat related, not strictly to eligibility policies. Adolescent and School Health and Reproductive Health Programs recently released an updated minor consent and confidentiality resource. I think many of you have seen the old one that was called like Minor Rights Consent to Access Health Services. But a new one is just updated and posted on our website. Really tries to outline in somewhat more plain language the statutes around minor consent for specific healthcare services and how it relates to confidentiality. The audience is primarily providers, but could also be useful for parents or school board members or other people who are looking for clarity on minor consent statute. We are in the process of getting it printed, and so all SBHCs will get 4 paper copies in the mail, 2 English and 2 Spanish, and then we'll have a lot more available if people need them. Oh yeah, and Ceci, I see in the chat, can we have all 4 in English? Yeah, I think if you want to order additional ones, we could send you 10 even. I think the breakdown of 2 English, 2 Spanish is just kind of our order that we submitted, but we can send you multiple additional ones if we need to. And just a reminder, this document is not legal advice. We're not lawyers, obviously, at the State Program Office, so we would advise you to talk with your legal counsel if you have questions about your consent policy, but this is really just meant as like a guide and information for you all. Okay, pause and see if there's any questions there before I just jump to a different topic.
Katie, on the opt-in and opt-out, it might be good to make a distinction between the medical opt-in and opt-out and the mental health opt-in and opt-out, as they may be different.
Right, so people maybe have different opt-in and opt-out policies depending on the types of service, right, that they're seeking at the SBHC. And that also goes into the minor consent for behavioral health and primary care services are different ages in Oregon. Thanks, Ceci. Okay, I'm going to keep us moving this is my last slide, I think, to a different other topic. So we recently heard from the HIV, STD, and viral hepatitis program who have a variety of programs to help ensure access to condoms. And they were interested in partnering with SBHCs to help you all get access to condoms. But we realized in the course of our conversations that we don't actually know where you all get your condoms or if this is even something you would be interested in. And so we told the STI program what we would do a couple poll questions to see what the interest is. And so, Carissa, could you poll? So the first question is really, where do you purchase condoms? So you can say maybe a medical supplier, if you get them from your local public health authority or a community-based organization. You can also say you don't offer condoms on site, and that's totally fine. Select other, and if you could write in the chat where that is, that would be super helpful for us. So HIV line. Okay, awesome.
And again, Katie, goes back to the school board not allowing us to do reproductive health, right? So we can even have that on site. Do we need it? Absolutely.
Yeah, this is really not like a judgment on whether people are doing it or not. It's really just to see if potential interest, if this is like an unmet need that we can help out with. So I'll give folks maybe another minute to respond. Okay. It's like most folks who provide condoms are getting them from a medical supplier or a local public health. It looks like maybe some other HIV Alliance or RH program. Great. Carissa, could you end this poll and launch the next one? So, oh wait, sorry, I'm gonna go back. Can I share the results of that? Oops. Maybe I'll just share the results. Can you all see the poll results? Maybe I didn't do it right.
Now we can see it.
Okay, you can see it? Okay, awesome. Great. Sorry, Chrissy, could you launch the second poll? Okay. So our second poll is really about, whoops, kind of to the question, did that launch? Did the second poll question launch?
I'll get it up. Technical difficulty.
Okay, sorry everybody. So yeah, the second question we wanted to ask you all is really about kind of what you're saying, Bessie, of like, if you don't offer condoms on site, like what are some of the barriers, if it is like a school board thing or if it's a supply thing, honestly. Okay, there it goes. Thank you. Thanks for bearing with us on the technical difficulties. Also, just want to shout out Carissa Halter, who's here helping us provide admin support because our normal coordinators meeting admin person Kwong is on extended vacation. So thank you, Carissa, for stepping in to help us today. Okay, so I will give folks a little bit of time to answer this question of if you don't offer contraceptives on site or condoms specifically, what the reason for that is. Hey, Carissa, could you end the poll and share results? Awesome, thank you. So it doesn't seem like cost is a barrier here. It's more of like the school district policy, school policy or medical sponsor policy, community opposition, and only a small said that SBHCs only serve young children. Okay, great. That's really helpful. Thank you so much. I think we will share this back with our friends in the HIV STI program and see maybe what the interest is in helping connect them with this information about condom access. If you are interested in talking with the STI program about accessing condoms, they do have bulk ordering and they have a small pilot project for individual condom mailings that they do. That's definitely something we could talk about, and we may have them come to a upcoming coordinators meeting to share some information with us. So.
And maybe sharing this poll with ODE would be good too.
We could definitely do that, sure. Okay. I am gonna move us on to grant updates. I think the first one up is Micah. Go ahead, Micah.
Hi, everyone. Micah Rotman. I use their he pronouns, and I'm the school mental health specialist. I think I've met a lot of you or you've heard me talk before. And so I'm going to give a really brief overview around this mental health expansion grant work group that we convened over the past, I don't know, when was May? Since May 2022, we've convened seven 7 work group meetings. I guess I should just back up and say, so the mental health expansion grant, for those of you who don't know, is a pot of money that is separate from the base funding, and it's broken up into sort of two pieces. So there's what we call the capacity grant, and that's the bulk of the money goes out to support providers at school-based health centers to provide mental health services. We've had this funding since 2013. And then there's the youth-led project grant that is a smaller pot of funding. It goes out to less sites and is really to support youth-led projects that are connected to school-based health centers or that are connected to mental health prevention efforts. So the work group was really to help us to give us some recommendations around grant requirements and funding allocation for both of these grants. And then from there, the state program office is really looking to the larger SBHC community to get some feedback, which I'll talk about in just a second. Kate, if you want to take us to the next slide. So I'm just going to name, this can be a little bit confusing, so bear with me when I sort of explain some of the recommendations and then what the SPO is doing with them around funding. This one I'm first talking about is for the capacity grant, so the one for provider money. And historically it was allocated based on this funding formula. Kate and staff who've both been in my position before have done a lot of work with you all and to put this forward. Working with the work group, we talked about what it would look like to implement a tiered funding model. And I just it's in bold. I don't know, I can just keep emphasizing this is really only if we were to get more money through the legislative session. We would need a budget increase to implement this. And I know it can seem confusing, but I promise that our goal is to simplify the process for the mental health expansion grant moving forward. So the proposed model that we're working with as sort of our goal of what we'd love to get to is for the first site that a SBHC system has, and we define system as school-based health centers within a county that are under the same medical sponsor. There's a couple of wonky ones in here, but that's the general definition of a system. So the first site in a system, $175,000 for the biennium. If there's 2 sites in a system, then it would be that 175 plus 125 for that second one. And then once there's 3 or more, it would be those first 2 chunks of money plus $50,000 for any additional site. And I'll talk about it in a minute. I sent out an email with the spreadsheet, so all of this information should have hit your inboxes last week. But really, the funding can get moved around between sites. So it might look like it's well, this is for this site, this is for this site, this is for this site. But really, the end picture would be this is the amount of funding for this system for the mental health expansion grant. And then we know that sites know where their needs are, communities know where their needs are, and folks would be able to move their money around accordingly. Next slide, Kate. This is where actually maybe it gets a little confusing. We don't have that much money. That's our goal. That's where we'd like to get to. We'd love to be able to implement this tiered funding model that allows us to shrink some of the gaps that are in funding right now. It's pretty extreme, the distinction between some of our lowest funded sites and systems and our highest funded sites and systems. And since we don't have the money to get to that tiered funding model, we were proposing this sort of stepping stone model to get there, knowing that there's some other things in the works. I know Rosalind mentioned the legislative stuff, and I know Maureen and the Alliance will talk about it towards the end of the meeting. So what we're proposing, and this is all included in the survey that I'll make a plug for in a minute, is that we would implement bumpers. So there would be a lot of shifts to the 2023-2025 biennium funding. And it would essentially be based on whether or not a system's current award that they got in 2021-2023 is less than or greater than what the award would be if we were to have the funding for the tiered model. And we calculated it at 10% because that would be the thing that would allow us to stick within our current budget. A little wiggle room. I think Rosalind's helping us allocate a little bit of funding over to the mental health expansion grant to do this. But so if a system award, if a current award is under what the tiered funding amount would be, that system would get a 10% increase in 2023, 2025. And if a system's current award is greater than what that would be, so whether it's 175 or 300 or 350 based on their sites, those systems would see a 10% decrease in their 2023, 2025 award. And really the intent around this is, like I said, it's sort of those stepping stones. It's about closing those gaps between awards. And I think with our goal is, with all of this, is trying to get us to a place where there's a base investment across the state for mental health services and school-based health centers, because currently that's not the case. Unfortunately, we wouldn't have enough funding right now to bring in new sites. So if there's current, it would only be for current mental health expansion grantees. So if it's a new site that, you know, just certified, is in the process of certifying right now, without a financial increase, without a budget increase through the legislative session, those sites wouldn't be eligible. And we have a few sites, a few systems that also currently don't get mental health expansion grant funding for various reasons. And those systems also would not be brought in with our proposal. And if there's questions, put them in the chat. And I'm trying to just explain this in the clearest way possible. And I will get to it too, but there'll be an opportunity for some Q&A next week, I think. I just put all the pictures of my dogs in here to make it feel less overwhelming. Maybe it only feels overwhelming for me because I'm trying to manage this whole wild grant shift. So those were the recommendations around the capacity funding allocation. The other things we worked on with the work group was some updates to the capacity grant requirements. So some examples that hopefully you all saw in the email that went out on February 2nd was, you know, clarification, for instance, being able to clarify that the money can be dispersed across a number of staff positions, because as it was written, it could come across as being like it could only be used for one staff person. I think strengthening some of our language around health equity and youth-centered clinical care, removing language around losing funding if there's staff vacancies, because we know that we're in a workforce shortage, and that language doesn't necessarily reflect the reality of what you all are navigating with this. And then probably one of the bigger things is some proposed flexibility with staffing types in 2021. We changed it. Prior to 2021, it could only be folks who were QMHPs, qualified mental health professionals. We changed it to include QMHAs. We know that there's different billing stuff that happens for various sites around that. And we're hoping to add in some other language that adds some flexibility around staffing types based on credentials or certification. So some language in there. And then really just wanting to emphasize here, like, again, at the end of the day, we know that sites are going to know what's best for them and their communities. So just because we're allowing QMHAs or you know, a traditional health worker, community health worker to be funded under this grant, if the thing that works for your model is to have an LCSW, like that's all still fine under this grant. And so really trying to just get that flexibility in there. And then the other piece is talking about the youth-led project grant. And we still have some other steps to figure out with that, but currently what we're looking at is reaching out to the current grantees to determine their interest in continuing with the grant. Again, there's more information in that email that was sent out on February 2nd. And if you are a youth-led project grantee, just like anticipate that you'll hear from me in the next week, hopefully by the end of this week around that. And no other some other updates around hopefully strengthening, again, some of the stuff around health equity, what it means to be a youth-led project, and potentially some opportunities to partner with either community-based organizations or regional organizations that could amplify some of the work that the folks doing the youth-led projects are doing. And then I think the last slide, not a dog, this is my cat Damon, who's very vocal, is just to let you all know that I sent out that email. It's a ton of information. It kind of feels like information overload. So I hope you all are able to move through it in a pace that works for you. It's really important for our team to get feedback from those of you doing the work, from the broader SBHC community, so that we can make sure that any changes we're implementing are going to work for you all and are in line with your needs and goals as you operationalize this work. Hoping to get responses by Friday, February 17th, because Kate and I will be presenting, who are presenting to Kate Clow on, I always mess up, the conference of local health officials.
Conference or coalition, I've never.
They're
One's the
different entities.
advocacy,
There's-
yeah.
Yes. But anyway, we're doing a presentation to see if they will sort of give us a green light on some of the changes we're hoping to implement. So that's part of the tight turnaround on that survey. Thank you for those of you who have completed it already. And just so folks know, we're also holding a Q&A session on February 14th at 10 a.m. The Zoom link is in that same email that I sent out on the 14th. And so if there's questions that people have after looking at the survey, if they want to talk about it, please attend that Q&A, or feel free to just email me literally whenever, and I will respond and talk about all the things at great length with anyone who's interested in doing that. And then I also just wanted to use the space to once again thank the work group members who participated. It was 7 90-minute meetings. We really got through a lot of material. There was some stuff that I asked folks to do between meetings, and I just want to quadruple appreciate folks who spent so much time, and just the generosity and the thoughtfulness about thinking about the whole state, even when folks were talking about like potential cuts to their programs or things that wouldn't work as good for them, but they know it would be better for maybe the SBHC community at large. So lots of appreciation for those of you who were part of that work group, and preemptive thank you for those of you who are going to fill out the survey or who have done it already. I think that's it. If there's questions, reach out to me directly or put them in the chat, and I'll try my best to do them.
You can do it, Micah.
What's that?
You can do it.
Okay, thanks. I appreciate your vote of confidence. It means a lot to me. And that's it for Mental Health Expansion Grant.
Thanks, Micah. Lots more to come. You will hear a lot more about this from us, I think, in the coming months. Okay, I'm going to switch gears and turn it over to Stephanie Murray and Rebecca Jacobs about the mobile and telehealth grants.
Hi, everyone. Stephanie Murray, she, her pronouns. I'm the School Linked Programs Coordinator, and I coordinate our mobile pilot, our telehealth pilot, and our school nursing pilot program. This is just a brief update about where the grantees are right now. As I've mentioned before, there are 4 mobile grantees. This grant went to education service districts, ESDs, and school districts. There are 4 grantees, and right now they're continuing to work on their needs assessment, which was the major deliverable for this pilot period. They are also working on agreements, creating agreements between the clinic that will be providing the services and the host school districts about sort of what that would look like. They are planning on, or have already begun, some level of service provision. And looking forward to the next biennium, they are providing feedback on some potential operations criteria for the next biennium. And that includes, it's pretty similar to what we have for current school-based health centers. So it includes, hours of service, requirements on equipment and infrastructure, and then the types of services provided. We are building some additional flexibility, it seems, into this grant program so that the minimum service hours won't be the number of hours per week, but potentially the number of hours per month. So more to come, I think, as this program develops. Next slide. The telehealth grantees, these are 3 grantees. This grant went to 3 school-based health centers. So the eligible grantees were certified school-based health centers. And the idea is that they are providing services via telehealth to students in schools that do not have school-based health centers. So a little bit of a hub and spoke model. They are also continuing with their needs assessment, which was the major deliverable of this grant period. A few of them are troubleshooting IT challenges with their school districts. As you could imagine, with telehealth, IT is sort of a critical piece of infrastructure for running this program. And then they are either planning on or beginning to provide services. So I think that spring especially will be a time where we're going to see how the rubber meets the road in terms of this program. So if anybody has any questions about mobile or telehealth, or if you are interested at all in maybe potentially delving into these programs, definitely please get in touch with me or Rebecca Jacobs, and we'd be happy to answer any questions. That's it for me.
Thanks, Stephanie. Okay, I'm going to move us right along to hearing from Melanie about training and technical assistance in the state program office.
All right. Hi, folks. I am back. Melanie over here. So I have quite a few training and technical assistance opportunities for you all throughout the end of this school year. First off, we're working with Advocates for Youth to put on a communications and messaging strategy training. This is really around helping you all set up systems to develop messaging and response strategies for tough conversations that come up around the work that you all are doing. That training will be on April 20th from 10:30 to noon. And I will be sending out a Zoom registration. With it in March or so, try not to do it too early. So please save the date on that training. Next slide. And we're also going to be offering 2 open forums, kind of continuing a setup that we tried out last fall. So the 2 open forums, one will be with our early and periodic screening, diagnostic, and treatment program that will be speaking later on in this meeting. So this will be a little bit more of an opportunity to learn more about that particular program and how that affects your clinic operations. That will be on March 15th from 2 to 3 p.m. Save the date for that because the Zoom's coming for that one as well. And then we're also working on putting together an open forum to talk about supports for students who identify as LGBTQ2SIA+. And we're working on the date for that. And the audience for that is anybody who works directly with young people. Oh, and I can't forget to note the furry friends that we have on the screen here as we're on highlighting our pets. These are my 2 kittens that I adopted in July. And I just had to show, like, it's a little bit of, you'll see what's to come on more of kitten photos, but this is when they were first adopted. Next slide. You can see they're getting a little bigger in this photo now. This is like a few months after I adopted them. They're already getting giant at that point. So we're also going to be doing 2 data trainings from our lovely Loretta. We'll be putting on a key performance measure training on May 2nd from 2 to 3 p.m. and an operational profile training on August 22nd from 2 to 3:30. The invitations will go out to those closer to those training dates. Next slide. Oh, I just want to acknowledge there's a question in the chat. Is Advocates for Youth training the same training that was offered in November, or is it different? That training was fantastic. Good question. So we worked with Advocates for Youth to put on a training series for our school health services planning grantees. And it's not the same training, it's very similar. So if you went to that series, you can attend this one, but it's a lot of the same information, but it'll be structured specifically towards folks that are operating school-based health centers. Hopefully that answered your question. Yeah, great. Oh, and more training opportunities. I know we always plug the next coordinators meeting at the end of our current coordinators meeting. So here's the information for you one time now, and you'll get it again later. So May 10th, 1 to 3. And then I just also want to plug our bi-monthly newsletter that we've been putting out. I put the link to subscribe to it there, and I can put it in the chat as well if you haven't already subscribed. We include we share a lot of training and technical assistance opportunities and information that we get from our partners, and also do some updates of our own. So if you aren't already subscribed to that, I highly recommend that you subscribe to it. And then you can see that now my cats that are brothers are full grown and fully bonded and love their lounge time. Next slide. All right, so what happens after this school year? So we are working, our team is working on putting together a training and technical assistance plan for the next biennium. Right now we're working on assessing the top priority areas that we want to focus on, and then we'll work on identifying mechanisms to address those priority areas. So how would we actually implement trainings on the topics that we think are important after listening to you all. And then we would develop a timeline and start acting, and then share the plan with you all so you can get excited about all the opportunities that we have coming up. And then I have a poll question for you all. All right. So in order to inform our planning process, I'd love to know from you all, what style of engagement do you want us to prioritize the most? So basically multi-session deep dive trainings are kind of like series of things. I know some of you have heard about the Echo Train that we are doing, where we kind of deep dive. It's a group training. There can be lots of opportunities for dialogue and really kind of learning a lot about a particular topic. More opportunities to talk and learn from each other around the state. So this could be in the open forums, or having more spaces for you all to talk to each other and get to know each other and have that community building opportunity. And then also another option can be doing as needed specialized individual support. So if one particular school-based health center really needs help with billing, or really needs help with marketing or something like that, then that there's opportunity for them to get that particular support. And I just want to point out that these aren't the only options, and we may be able to provide opportunities related to all of them. We're just aiming to get a pulse on what you all want from us and what you have time to engage in, so that we know how we might want to kind of spend a little bit more time prioritizing based off of what you all think. And I think we'll give it like maybe another 30 seconds because I talked a lot. I have no idea how many people have responded. So if we've gotten a lot of responses, then feel free to wrap it up. And do you want to share it back out, Kate? Or Carissa? See what else said? All right. You all want to talk to each other and do some deep dives. That's good to know. Excellent. Thanks for participating. I think that's all I have.
Thank you, Melanie, and everybody for responding to the poll. This will really help us as we're making some plans for next school year. So, okay, we're getting most of the way through our updates. I am going to turn it over to Kavita from our program to share a little bit about your data that you've submitted to us. Kavita, it's all you.
Hello, everyone. I'm Kavita Gavan. I use she, her pronouns, and I'm one of the research analysts with the adolescent and school health team. So today I will be presenting a snapshot of the SBHC utilization data running from 2018 to 2022. What we are going to look at is 3-year changes in the data for 3 specific data points: school-age clients, total well-care visits for 5 to 21, and immunizations for 9 to 21 year olds. So though we're presenting the data from 18 to 22, we have decided to exclude 2020-21 data from the presentation for a couple of reasons. That was the year of the pandemic, and there were a lot of school closures. We received incomplete data from a lot of SBHCs, and also a lot of the data was outside the norm of our other SBHC data points. So that's the reason for the exclusion. And yesterday, everyone, like SBHC coordinators, should have received an email that had the SBHC utilization data included on the email. So the email had 2 documents. One is the SBHC utilization trend data key sheet, which includes unblinded site level raw data for the 3 data points that we just talked about with your SBHC ID. And the second document was the one that included all the graphs. Thanks, Kate, for moving us to the next slide. Yeah, so on the raw data, you will notice a lot of changes at the SBHC level. Okay, just give me a second. I have a screen open here. Let me just close it. Okay. So that is what the data that you received is. Some of you may wonder why the data looks so different than your KPM data. So the reason is because the KPM data is a chart audit sample versus this data that we will be looking at today is from the full encounter data review, and only counts like well visits and immunizations that occur at the SBHC have been used to report on this data. So that's why the data looks different. Next slide, please. Okay. So the first graph here that reports on the percent of SBHC clients that was school age, that is 5 to 21 for the year 21-22. Just wanted to point out a couple of things here. So the blue bar that you can see is the state level data, which is at 65%. So 65% of the SBHC clients were school age, and all the other SBHCs are either the other bars. So if you notice on the x-axis, there are a couple of numbers. Those are your SBHC IDs. So you can always go back to the sheets that were the documents that were shared yesterday and look for where your SBHC stands on this graph. Next slide, please. This graph reports on the percent of 5 to 21-year-old SBHC clients that received a comprehensive well visit for 21-22. And again, here the green bar is the state level data, which is at 39%. And yeah, you can, the rest of the SBHCs are like sort of middle. Third, next slide, please. And the third graph here reports on the percent of 9 to 21-year-old SBHC clients receiving an immunization for 21-22. And the red bar here represents the state level data, which is at 34% immunization rate. Next slide, please. Okay. So the last graph here shows the statewide trends in SBHC utilization. 2 things that I would like to point out here is the decrease in the percent of clients 5 to 21 year olds from like 2016 to 2022 almost went down by 10%. We feel I feel one of the reason is pandemic related, but yeah, I just wanted to point that out. And then the immunization rate increased slightly, like from 30% to 34%.
Kavita, did you send this one as well as the others? I remember seeing the others, not this one.
Not this graph, not this particular graph on the slide. The graph document includes the graphs for 3 years, like 18, 19, and 22, not this last graph. So once the presentation is shared out, you will have this graph as part of this presentation. Okay, and that was all I had today. Before I move on to the questions, I will pass it on to Sarah for a quick poll question.
Yeah, thanks, Kavita. So hopefully everybody was able to see the data that was sent out yesterday, where you can look at your individual site level data for these 3 indicators that Kavita presented. And this is something, for those of you who've been around for a while, something that we used to do in our fall in-person coordinators meeting. And we changed up a little bit the data points that we were looking at. But we wanted to get back to it after taking a couple-year break due to COVID. And we also started thinking about whether this is something that you all like, whether you would like, there are different things that you would like to see in the future. So this year we did well visits, immunizations, and then we did the % of school-aged youth, which is a new thing, a new data point for us to put forward, but we've definitely seen some changes post-COVID, so we wanted to present that to you all. But wanted some input from you about whether there's other data points that you might like to see in the future. And so we have a poll question, if we can launch that. So this is just, are there any other topics or data points that you would like to see us share at a future meeting, similar to this, where we're presenting site level data? And so we have a few options here that you could choose from, or you could write something else in. So I'll just pause for a second and let folks fill that out. You also can email us if you have thoughts after the fact. So let's wait a second. And then also, if you have questions about any of the things that Kavita presented on, those can also go into the chat. Okay, I see Nancy in the chat. And these would be, just to be clear, these would be things that we pull out of our encounter data. And so something like screening is really challenging because sometimes the screening data doesn't show up super well in the excuse me, encounter billing data, but treatment, yeah. Okay, yep, thanks, Lisa. So yeah, if you guys can do that poll or send us an email, we would really appreciate it. And then if you, I'm not seeing any questions in the chat, but Kavita can keep her eyes on the chat if there are questions that come in and respond to those. And again, you also should feel free to shoot us an email. Separate out integrated behavioral health and mental health. Yes, definitely on our radar, Alex. Okay, thank you.
Great, thanks everyone. Did it display the results?
Oh, here we go.
Excellent. This is really helpful. Thank you.
Great. We are running a little over time, so I'm going to move us on really quickly. Just wanted to let you all know to keep an eye out. We're working on our 2023 status update. If you love data, if you want to see more of your data, it's going to be in here. It's going to be more visual. I just got the latest design copy from our publications department this morning. Really hoping to have this ready by March, early March for you all. And we are going to again return to our pre-COVID practice of printing this out in paper versions and sending it to all of your SBHC so you have it. For folks who are new, this is an annual report that our program does of your SBHC encounter data. So this is just one way that we use your data to present it back to you. So keep an eye out for that. Really excited to share it with you in a couple weeks. Okay, I'm going to really quickly pass on to our last presenter from about the Lev Schneiderman about our Adolescent School Health Statewide Youth Advisory Council.
Great. I will go quickly because we're over time. You can go to the next slide. My name is Lev Schneiderman. I use they, them pronouns, and I am the program coordinator for the COVID-19 Recovery Fund through a CDC grant. And one of the things that we do with the grant is we facilitate a youth advisory council. So it's 20 youth from across the state who are deciding how to spend $1 million of COVID recovery funds. And they've been working since June on creating or figuring out how they want to spend these funds. And one thing that they did is they created a really awesome equity statement, which I'm going to read to you. And it's, as the OHA Youth Advisory Council, we make youth-informed decisions that value human life, diversity, safety, stability, quality of life, and the rights of every human being. We aim to improve the COVID-19 recovery of communities across the entirety of Oregon by creating and accounting for meaningful outcomes from our $1 million budget proposal. And so they're using this equity statement to decide how they want to spend the money. And what they decided is they broke up into subcommittees based on topics that they were really excited about. Will you go to the next slide, Carissa? So they ended up breaking into 3 main subcommittees, and those are the funding priorities. So there was a subcommittee on cultural and community engagement. There was a subcommittee on food, housing, and income support. And then there was a subcommittee on mental health support. And so now they've worked really, really hard to create an application that's going to go out. We're hoping at the beginning of March with those funding priorities. And schools and community-based organizations and school groups can apply for these funds. And I will make sure to send it out to all the SBHCs. But we're just finalizing the application. The questions are really good. We've gone through this entire process of how do we create an application that's based in your values? How do you assess applicant when they apply, and how do you reflect that in the questions you're asking? And they've all worked really hard to make a pretty beautiful application that I'm very excited to present to the state. So when that happens, we will let you know. And that's sort of where we're at in the finalization of that application. So we'll let you know very soon.
Awesome. Thank you so much, Lev. Looks like we have some stuff in the chat. Wes has some appreciation for the SBHC folks who received COVID-19 recovery funds. Okay, that was a lot. I'll pause very briefly for questions, but I also want to make sure to give you all a break. Any questions that folks have? Okay. I'm going to just move us right into break. If you have a question, feel free to write it on the chat or just stay here and we can talk. Maybe let's come back at 2:16 to give our friends at the oral health program some of their time back. And then after the break, we will jump right into oral health updates. Thanks, everybody. Sorry it was so brief. But I want to make sure that we have time to share from our presenters that we have here today. So first we have Karen Phillips from the OHA Oral Health Program. Karen, I have your slides queued up. Are you ready to present?
Yes, awesome. Thank you.
Yeah.
I didn't think to include dogs in my slides, so I've been trying to figure out how to copy and paste into the chat. But I'm not, I don't know how to do that. So, but I appreciate the photos that people have shared. I have 2 big dogs. Thanks for having me. My name is Karen Phillips. I'm a dental hygienist by profession, and I'm now school oral health programs coordinator for OHA. I still like we're doing the smile screening right now, where we go into schools and actually get to look in kids' mouths. So I appreciate that I still get to do some clinical activities. I have in my public health career, I've worked with FQHCs in their school-based health centers, Head Starts, WIC, in school-based programs, school-based sealant programs. Next slide, please. So we're going to be talking about the what's in your certification standards and how potentially you can implement varnish in your programs. I don't know if we can do a show of hands reactions. How many of you are already have already added fluoride varnish to your programs? And then maybe Rebecca or Kate, you can throw out a number if there's a show of hands there. What's in your standard is a visual inspection of teeth and gums, preventive oral health counseling, and then offering a fluoride supplement prescription, fluoride drops for infants, and then tablets usually for about school age children, and then an on-site referral for a comprehensive oral health evaluation and treatment referral. And that could look like being referred into a dental home. And next slide, please. I just, show of hands, what was, were you able to kind of count them, or it went too fast?
They went
Yeah,
away really fast.
Yeah. I was thinking about that. I thought, oh, it does go away quickly. So I just, this is kind of focused on adolescent oral health, but fluoride varnish, it used to be that we primarily used varnish on younger kids, and we now know that fluoride varnish is recommended for any age, and particularly for youth that are at risk. And if kids have decay or cavities as younger children, that's one of the strongest indicators of tooth decay in their permanent teeth. So continually working upstream to prevent cavities earlier on will also help when those permanent teeth come in. Adolescents are present with unique challenges. Caries rates remain really high. The CDC reports that in kids aged 12 to 19, over half of them have had a cavity on a permanent tooth. They have immature permanent enamel because the enamel is still forming even as it's erupting into the mouth, and so it's getting attacked by the harsh environment in the mouth, and perhaps a not high quality nutrition, exposure to, and then maybe exposure to sugar sweetened beverages. There may be some independence in seeking or avoiding care. Oral hygiene may be a low priority, and then talked about the nutritional habits. And next slide. Adolescents tend to have higher rates of gingivitis due to hormonal changes. Orthodontia makes it really hard to clean the teeth and floss, or just do something to clean around the brackets and underneath the wires. And again, oral hygiene may be a low priority. Next slide. So this is from the 2020 Student Health Survey. There are some specific data points related to dental hygiene and dental visits. But I wanted to focus on these that offer opportunities for dual messaging in the school-based health center setting. And I'm sure you are aware of how much e-cigarettes and vaping use in adolescents has gone up recently, and that and it's very easy to access. Next slide. And the same with marijuana use, exorbitant high use, and very easy to access. And next slide. Soda consumption, and this is separated into like soda or pop, and then question 86, Red Bull and Kool-Aid. I'm not sure Kool-Aid is still around, but any sugar sweetened beverage that's out there. And 0 to 7 is about 30%, but really about 3/4 of students who are self-reporting report 0 to 3 times in the last 7 days for sugar sweetened beverage consumption. And next slide. So some opportunities when you have teenagers in particular in your room is to check the teeth and gums at adolescent well child visits, apply fluoride varnish. You can bill for oral health services, bill for varnish, refer for a regular dental checkup and or dental treatment, and encourage participation in school dental sealant programs. You can check with a school where you're located to see if they have a school dental sealant program that comes in, and you can also check with OHA, and we can refer you to a sealant program in that county or that area. The other thing I wanted to say is that there's a recent CareQuest study, and they focus on oral health, but in the last year, they put out some data that for kids who have not seen a dentist in the last year, 1/3 of those went on to get further dental treatment after a school-based dental visit, whether it was a school dental sealant program or a school-based services, whether it was a dental person that was on site and stayed on site, or they came in during a short period of time. And that's mostly for the younger kids that forms don't get lost in backpacks, but it was about 60% for elementary, about 40% for middle schoolers, and then about 30% for high schoolers. Next slide. So again, talking about dual messaging, if you're talking about nutrition, the sugar sweetened beverages and just sugar in general and how that affects teeth and gums. Dentists can give vaccines in Oregon. We have legislation around that. And oropharyngeal cancer is one of the fastest growing cancers in males still. And HPV vaccine manifests, or not the vaccine, but HPV can manifest itself in the mouth and oral tissues. And that's something that for dental visits that we are looking for. We're always doing at least an oral cancer screening. And then also talking about self-esteem related to oral hygiene and clean breath, because we know that good oral health and healthy smiles increases self-esteem, and discuss the use of any form of tobacco, whether it's being smoked or vaped or chewed, and then again, the sugar sweetened beverage and sugar consumption specifically related to how it affects the teeth. And next slide, please. So for applying fluoride varnish, it's pretty easy, but I recognize that it can be out of the realm. It's teeth, and it can take 30 seconds, maybe even less. Had included this photo of a mixed dentition because, again, it can be younger kids, mixed dentition, older students that might have all of their permanent teeth in. The supplies that you need are gloves, the fluoride varnish, and the gauze. And the fluoride varnish is, well, I'm not sure with inflation, but maybe $2 or $3 for a single unit dose. And they come with these brushes. So you dry the top or bottom teeth with gauze or I'm assuming you're more likely to have gauze in your rooms as opposed to cotton rolls. And then just lightly dry the teeth. And that's not a have to. You don't have to dry the teeth. It just soaks into the tooth just slightly better. And apply the varnish. It doesn't have to be painting each individual tooth. You just kind of take the toothbrush and yes, an RN can do this. And then just almost like you're swiping over each teeth. One of the areas that's the most likely to decay, and you might see some dark lines or white spots, is up at the gum line. So really be careful, but again, you don't have to spend a ton of time on it when you're going over the gum line. And then do the same thing for the bottom teeth, and you're getting all those surfaces, the cheek side, the palate side, and then the top surfaces. Avoid it's counterintuitive, but don't encourage spitting because the varnish is sticky like honey. And so if they're kind of sucking in their cheeks and spitting out, it actually makes it stickier inside the mouth. So I usually just offer a paper towel or more gauze or something like that they can just kind of wipe the excess off their mouth. Next slide, please. So billing is not my forte in this part, but I know that this, again, it can take a few seconds. It can be included in your well-child visits. It is generally recommended for 3 to 4 times a year. Fluoride varnish, when we go into Head Starts, it's 3 times a year. And then generally speaking, the younger kids are getting a fluoride varnish treatment at a doctor's office or a dental office. So they're getting fluoride varnish about 4 times a year. Research shows that more than that doesn't necessarily provide any extra benefit. It doesn't hurt, but it doesn't provide extra benefit. So we can conserve our resources. I'm not sure about the reimbursement rates on this. This is a little bit older, so talk with Rebecca. I'm not really sure. So
we can get the current rates. Yeah.
Okay. Yeah. And so this D code, D0191 is the screening code. And then the varnish has another code. Okay. And then next slide, please. And one of the reasons that we want to do this is that we have, Oregon is rated 48th in the country, and only 22% of our population has access to community fluoridated water. So all of our population is not receiving the appropriate amount of fluoride exposure for healthy teeth. Again, it's a quick procedure. So in Oregon, there needs to be, you need to look at a first tooth or a Smiles for Life how-to video. The first tooth, I don't know that is still up because who was working on that project, it was Oregan Oral Health Coalition, and they've disbanded. So I'm not sure if First Tooth is still going right now, but I can find that out. I can find out who you'd be referred to for that information, and where you could get TA for this and for billing. And I think that's it. Next slide, please. Oh, sorry. No, this is kind of a flow. So room the patient, do the oral health assessment, enter into EHR, determine the need for a dental referral, offer fluoride, and I think, I'm not sure, I don't know that a caries risk assessment is required. I think that some organizations require this and some don't. So, and there's a lot of different caries risk assessments out there. Like I said earlier, child who has any decay as a young child, it's a strong indicator that they automatically are at high risk, and there's a stronger indicator that they're going to have cavities in their adult teeth. Apply varnish and initiate the oral health referral if needed. And I think, so, and this, I borrowed this slide, but you also could do, I would say whatever flow works for your providers. But you could also offer the fluoride earlier on, like right when you're doing the oral health assessment and finishing up the well child visit. Okay, so now I think this is the last slide. Yep. Okay, so I saw several questions come in.
Yeah, I think there are a couple questions in the chat about kind of scrolling up which types of providers could do this. So could an RN and MA is kind of the first ones. And I think Rebecca Jacobs gave some answers there.
Yes, yes, yep.
So it sounds like an RN, an MA can do this after an oral exam provider, in case folks can't see the chat.
Yep. Okay, so it looks like all those questions are all pretty related. So yes.
I was just wondering about an ICD-9 code, if they were to use that.
And again, that's not my that's not my wheelhouse, but I can find out. The other thing is Multnomah County has a very robust fluoride varnish. They've integration into their school-based health centers, so they would be a great resource for this. And there's a few other there's one in Hood River associated with One Community Health. They've just recently really integrated fluoride varnish into their school-based health center.
Thank you.
Thanks so much.
Any other questions? Oh, pardon?
Oh, I was just
go ahead. You're welcome.
Yeah, and here on the screen is Karen's contact information. Yeah, I think just one of the reasons we brought Karen here is we know that there's such a huge dental provider shortage around the state, and want to encourage folks to take every opportunity to do prevention work as they can in school-based health centers. So thanks for being such a great resource, Karen.
Yeah, you're welcome. That's a really good point. Yeah, we've been hearing, it's months and months before people can get into the dentist, whether or not patients are on OHP or private practice. I even find that my own dentist, it's hard to get into, even just for cleaning. And the Medicaid data from during the pandemic shows how few dental visits there were by younger children and children in general going to the dentist.
Thanks so much for being here and for sharing that information. We are running behind, so I'm gonna turn things over to Laura and Jessica from OHA to talk about EPSDT.
Thanks, Kate. Hi, folks. I'm Laura Sisolak. I'm with the Oregon Health Authority in the Office of Health Policy, and I'm privileged to work with Jessica Ickes, who's joined me today, and our colleague Liz Stewart on the team of folks who are implementing a pretty major policy shift around EPSDT, and I will go into a little detail about what that is. Are folks hearing me okay? Just checking in. I've heard some. Yeah, do my best. Next slide, please. Just noting some other folks, particularly our clinician leadership who are not on our call today, but who help advise us and are part of our team. Also, Dr. Carey and Dr. Mountner involved in reviewing claims for these services, which we'll describe shortly. Next slide. Yep, thank you. So what I'm hoping is that we'll be doing in this session a really brief overview of this policy change, understand what's changed and what hasn't, point you to some resources for additional guidance. But I did want to note that I've talked with Kate and we've made arrangements to also join your meeting in March, is it the 15th, Kate, to go into a little bit more detail about additional information about implementing this policy. Next slide. And next slide. Okay, so EPSDT stands for Early and Periodic Screening, Diagnostic, and Treatment Benefit. It is a federally defined benefit for all Medicaid recipients under age 21. And here in Oregon, that means anybody who's enrolled in Medicaid or the Oregon Health Plan automatically qualifies for this benefit. It's not necessary to enroll in a program to access this. It essentially constitutes the child and youth benefit within OHP, and we have some changes to this that I'll explain why shortly. What it does is it requires all states to provide comprehensive services and furnish all Medicaid coverable, appropriate, and medically necessary services to correct and ameliorate health conditions. And paired with that, Oregon, and many of you probably know this, follows the Bright Futures periodicity schedule for screenings and evaluations. Next slide. As I noted, all OHP members under 21 qualify for this benefit. When somebody turns 21 in the month of their 21st birthday, they transition to Oregon's adult benefit. You may have heard that in the future, Oregon's Medicaid waiver that was just recently negotiated expands the child benefit to youth with special health care needs. That won't happen until July 2024, but I know some folks have asked about that, and when that does, when that eligibility expansion happens, those youth up to 26 will also qualify for EPSDT benefits. Important to note, this applies to both people who are in the open card or fee-for-service population, as well as those who are enrolled in coordinated care organizations. So until July 1, or excuse me, January 1 of this year, Oregon had always provided most of these EPSDT services. However, prior Medicaid waivers had allowed us to restrict coverage for treatment services, so just the T part, to people between age or over age 1, I should say, if those services fell below the funding line on what we call the prioritized list. And I'll describe that. My colleague Jessica will describe that in a moment. So some of you probably have heard of this, and that list existed to really identify treatments that maybe were experimental, did not have adequate evidence, were not cost effective, and this waiver had allowed us to not fund conditions that were below that line. That said, let's move to the next slide. As of January 1 of this year, we no longer have that waiver. And we really want to acknowledge there's been a great and vocal group of advocates that really help push for this change in Oregon. We welcome it. We really believe that we have been funding the vast majority of these services, but that in part the confusion about what was covered, what wasn't, what's on the prioritized list, and where really added up to a not insignificant barrier to care for kids under age 21. So moving forward, we must cover all medically necessary and medically appropriate services for kids, regardless of where that diagnosis falls on this prioritized list of health services, and whether it's a non-covered ancillary service, and even whether Oregon's state Medicaid plan covers the service. Next slide. Okay, I'm going to pass to my colleague Jessica Ickes and ask her to introduce herself and pick up from here.
Thanks, Laura. As Laura said, I'm Jessica Ickes. I am with the Medicaid Policy Unit with OHA, and I am the EPSDT Children's Policy Analyst. So what is the prioritized list? The prioritized list of health services is a tool used to show which services are generally covered by the Oregon Health Plan. The Health Evidence Review Commission, known as HERC, uses medical evidence to provide guidance about coverage of services. And what is important with this regarding EPSDT is that historically covered services appeared above the line on the prioritized list, and services below the line were not covered for OHP. This is still true for adults aged 21 and over, but this is not true for children and youth. That line on the prioritized list is not used for that anymore. Next slide. So both OHA and CCOs must comply with the EPSDT policy change and coverage requirements effective January 1, 2023. We are both required to ensure that services to OHP members under the age of 21 are not denied without an individual review for medical necessity and medical appropriateness. The current definitions are in OAR. We did provide a link there, and that Oregon follows the Bright Futures periodicity schedule. We committed to that previously and are going to continue with that. We must follow guidance for the application of prior authorization to EPSDT services. There's a few areas in which CCOs and OHA may differ, and that is on the actual prior authorization procedures and billing procedures. This does not mean that all services are covered in all instances. CCOs and OHA may use appropriate utilization management processes and require prior authorization for some services. Must have a billable code, CPT, HCPCS, or ICD-10 code. Must be Medicaid coverable. An example is it can't be something that's purely cosmetic. Still not allowed to do that. CCOs and OHA may utilize a preferred provider network. The provider must be a Medicaid enrolled provider and have a national provider identifier. And we are still required to be good stewards of resources and may only cover least costly alternatives, which is a part of the decision making, but it is not the sole decision making tool. Next slide. So what in Oregon, we under EPSDT, a service must be medically necessary and medically appropriate. We also use the definitions for dentally appropriate in our state, and we are required to provide comprehensive medical appropriate and medically necessary services needed to correct and ameliorate health conditions That is a big difference between the adult EPSDT program and the children one. Excuse me, there is no adult program for EPSDT. For adults and children in the EPSDT benefit, we can lessen and or improve a health condition. We do not have to cure a health condition in order for it to be funded. This includes services which, based on the child's individual circumstances, adversely affect the child's ability to grow, develop, or participate in school. And we use documentation needed to demonstrate medical necessity and appropriateness. We have outlined those in OHA's EPSDT provider guide. Next slide. So in reviewing these on the individual review case-by-case basis, we have 4 doctors as well as 9 nurse reviewers. We have 2 family practice physicians. We have 1 internal medicine, and we have Dr. Meg Carey, who's child and adolescent psychiatry. So EPSDT and school-based health services. EPSDT does not change the hierarchy of who pays for services. If something is a Medicaid eligible services in school, Medicaid pays for it. However, more treatment services may be deemed covered under EPSDT. As previously stated, Statement of Intent 4 is still a part of the definitions needed for medical necessity and medical appropriateness. And if a service is requested that relates to an individualized education plan, OHA will consider the IEP as part of the documentation for medical necessity and medical appropriateness. Sharing the IEP documentation or information requires parental approval. Next slide. So these requirements became effective January 1, 2023. We are to have full implementation as expected by the end of Q1 of 2023. The reason for that is that some of our systems at OHA are still being changed and improved so that we can get to full compliance and implementation of EPSDT as well. Next slide. So this is where you can find more information. All of the following slides are provided to you. It will be provided to you as well. There's a lot of information on our website. And these are all living documents. They will be updated regularly. And so do bookmark this page and reference it frequently. Next slide. And this is our email address. This comes to the entire EPSDT team. Please use it. Please send us questions. You feel free to give out this email address and our webpage to others who weren't able to be here. They are great resources of this program and the changes. And that is all. The rest of the slides on this documentation, on this presentation, we've cut out due to time. So you will have access to this as well, but most of them are resources. So please do look through them and let us know if you have any questions.
Thanks so much, Jessica and Laura, and sorry for the rush to get through the rest of the material. I know this is intensely complicated, so I just want to put in another plug for the open forum that will be happening in March, where you can get lots more information about EPSDT, and Jessica and Laura and others will be there to help answer any questions that folks have. Do feel free in the meantime to just put questions in the chat and we can answer them, but I do want to turn things over to Maureen and the Oregon School-Based Health Alliance to carry us out for the last presentation.
Hi all. I am going to fly through this so you all can get out of this meeting and move your bodies or something. I just wanted to share our new-ish mission. I don't know if we've like officially shared it in one of these meetings, but we have shared it out on our social media and stuff. But we do have a new mission, and you'll be able to read it in the slides if you haven't already. Let's go to the next slide, please. So Rosalind already shared our legislative agenda and what's in Senate Bill 549. So I won't really go into it too much. I can't remember if she shared the capital construction bill or not, though. So there were a couple updates. So one of the things was we are asking for an inflationary increase of 10%. So that would be the extra 6,000 per SBHC, but we're also asking for it to be tied to inflation in the future moving forward so that we don't have to keep asking for it. So if, Medicare gets an inflationary increase, CCOs do, but SBHCs don't. So that is one piece I wanted to add on there. And then we also have SB 552, which is to provide bond funds for SBHC capital construction, including pre-built modular clinics. And so we're hoping, and we're asking for $10 million so that, if a district is ready, partnerships are in place, but they don't have capital construction funding, that potentially they could still develop an SBHC there. So hopefully that will help communities if we're able to get that through. I want to mention quickly that it either came from Jessica or our admin email. She sent out an email with our one-page overview, which basically just has this information, but also an ask that if you would like to help advocate, that you could contact your legislator and ask them to sponsor the bill. And it had information about who's already sponsoring and how to find your legislator if you don't know who they are. So if you got that and would like to act on it, that would be great. If you didn't get it and want the information, I'm going to give you Jessica's email in the chat. And then let's see, next slide. Advocacy Day is coming up. We hope that you all, everyone that hasn't registered yet is still considering it. It is online again this year because there's construction at the Capitol. So it's it's more accessible to folks far away in that regard. And registration is open. Asia is the contact for that, and the link is in the chat. Next slide, please. We are putting on a youth adult partnership conference in April, and we would love to see you all there and any colleagues you might work with in the schools or other sectors as well. It's going to be open to anyone in any sector that wants to work with youth or does work with youth, and we'll be featuring youth and some of the work that they've been doing. So right now we are accepting the proposals to speak or present, and then sponsorships and tabling requests as well. And then that was the last slide, but there were a couple other things that I forgot to make a slide about. I've mentioned marketing materials before, and I know a few of you are working with Met Group, the marketing agency, and we'll begin kind of piloting some of them, but we are creating these marketing materials and a toolkit where you should be able to add your own SBHC information into the different materials and then share them. So there should be social media materials, posters, like flyers targeted to parents, youth, and community partners. So we're hoping to get that out in March. And so keep an eye out for information about that. We also have a little bit of funding so that if you work with YACs, or even if you don't have a YAC, but there are youth that you think would be interested in disseminating the information, we can provide a stipend for the YAC as a whole. And that's a $500 stipend. And so Hannah's leading that. She can work with you all, and she put a link in the chat for you to sign up. And then last but not least, we're going to be sending out membership invoices pretty soon, and an ask before that, an ask to you to make sure we have the correct contacts, because there's been so much turnover everywhere. We want to make sure we're reaching the right people. Just a reminder, membership's what pays for the advocacy, so we always appreciate it. And yeah, have a great afternoon. That is it.
Maureen, do folks have questions for Maureen or anyone else from the Alliance? I know there's lots of great links to resources and registration in the chat. You can see that. Any questions? Okay. Well, we had an action-packed, information-packed meeting today. Thank you to everybody for being here. Thanks to our presenters. Thank you to the coordinators and SBHC staff. Thanks for everything that you do and continue to do for young people in your communities. Just a reminder that we will post a recording and the slides on our website from the meeting today, and save the date for our spring SBHC coordinators meeting on May 10th. If you have questions or want to get in touch with our program before that, here again is our, oh, it looks like it's an out-of-date email address. I will put the right one in the chat, and you can feel free to reach out to us, and we will get back to you. Any other closing thoughts before we end? All right. Thank you so much, everybody. Happy winter. Looking forward to seeing you when it's a little warmer and sunnier outside in May. Take care.